Doc, I lost my job. Doc, I'm working 2 jobs. I'm working myself ragged. Doc, our child was on drugs and now in rehab. And Doc, my mother-in-law moved in who has Alzheimer's, and it's just been terribly stressful. So common denominator is always stress. Stress is the great equalizer. I don't care how great your hormones are. If you're under periods of stress, you're not going to feel as good when you're not, obviously. And the men that have the hardest time with this, the ones that are typically the hardest to treat, are the guys that are in their early 30s. Life becomes real at that age group. I mean, it just becomes real. You're not really young anymore because you're not in your 20s, but you're definitely not anywhere near old. But you're kind of caught up in that where you've usually got a wife, maybe young children, got a house payment, a car payment, you're establishing a career. That is stressful.
Yeah.
You're not going to feel your greatest all the time, and you can't use hormones to overcome it. All right. So just the key is that there are so many factors that go into how we feel and function every day besides hormones. But once you get your hormones fully optimal, then you should just check that box and move on to every other aspect of your life that you can improve on.
Exactly.
Take home message, Stephen. I'll get off my soapbox now.
Awesome. I guess the whole message is that we should try to raise our total testosterone to a certain number, whatever that is. It might be supraphysiological, of course, to have a free T between 30 and 60.
That's correct. For most men, some less, some maybe a little bit more, but that's where, and then you have to give it time to work. This doesn't work in days or weeks. This is months, and then it builds on itself year after year.
Yeah.
The greatest improvement that I see when a man first starts it is give them 6 or 12 months for sure, and make sure they have optimal levels. And then it works. Improvement will occur year to year as long as the man puts in what I call the sweat equity. You and I have the easy job. We can provide them with hormones and get their levels optimal. They have the difficult job. They have to eat right. They have to exercise. They have to try to get enough sleep and reduce their stress. So they have the hard job. And testosterone won't make any of that easy. Testosterone will reward effort. That's what it does. If you put in the work, you'll be rewarded for that work. It rewards effort, but it won't do it by itself.